Hey everyone, welcome to week 3. So as a reminder, this week your papers are due. If you should have any questions or if there's any difficulties, anything I can help answer, please feel free to send me an email. I'll be happy to answer any questions that I can. So this week we're going to be talking about trauma and the impact of trauma and its effects on current and future situations that the client is going to encounter. We're also going to be discussing trauma intervention because there are a lot of different trauma interventions that you can do. We're also going to be going into case management as well. So to start off, what is trauma? And a lot of you guys have had experience with understanding trauma and knowing that most of the clients that come to see you have endured some form of trauma in their life. So trauma is defined as a deeply distressing or disturbing experience. And this could be a physical or emotional experience. Trauma is often referred in a diagnosis form as post-traumatic stress disorder, or PTSD. And you're often going to see a lot of veterans with that attachment to them. So I think sometimes people think, well, post-traumatic stress disorder is, someone who's seen something so traumatic that they just can't get over it. However, there are many other forms of trauma out there. So trauma can be a physiological response, such as you could have headaches, you could have nausea, you could have bedwetting, you could have body aches. People can have a physiological response to the trauma based on their memories that they're having. If they're having nightmares, their body will physiologically respond to the trauma. There's also emotional reactions such as irritability, anxiety. That's where a lot of phobias come from. People are very fearful, and poor emotional regulation to start us off. So trauma on the brain, as you all know, can be shaped by good and bad experiences. Our brain is a sponge and it absorbs everything. The sight, sound, smell, everything that is around us, we absorb it. So our experiences, we naturally absorb as well. And, most people think traumas are severe incidents such as, rape, abuse, molestation, the war. However, one person's trauma is very different from another's. And, it could be, some people view, trauma, like I said, as really big, but someone's little trauma could be, a parent's divorce. And although someone might look at that as just a situation that a child, has to get over because it is happening, that is extremely traumatic for a child or adolescent to go through. Or even if you're in adulthood and, your parents have been together for 30 years and they decide to get a divorce, you're going to see that the reaction in the child's behavior or the adult's behavior, you're going to see it. And that's how they're responding to the trauma. So the next thing I wanted to talk about is stress hormones, because the way that your body reacts to certain types of traumas elevates your stress level, which, as we all know, can be good or bad. So, there's a lot of different types of stress, such as positive stress, which is a normal, essential part of healthy development, such as, starting a new semester or starting a new job. It's a healthy form of stress and a healthy form of anxiety. But then there's tolerable stress, and tolerable stress activates the body as a result of a long-lasting pain, such as like losing a loved one. Then there's toxic stress, which is an experience that is frequent and or long running, which is physical and or emotional abuse. So this stress absolutely affects the way we work and the way that people who have endured trauma work. Unfortunately, if people are in a certain stage of their stress, if they're experiencing toxic stress every single day, their traumatic response is going to be a lot greater than someone who, up and down experiences positive stress, one day, then tolerable stress the next day. So, when you're working with a client, really understanding what level of stress they endured during their trauma is really important, because once you figure out where they are in that stress level, you're going to be able to better understand how they've coped with that trauma before getting to you. So you're able to really work with them to manage that level down and to work with them, on that trauma. So the next thing I want to talk about is the flight or fight response. Because you're reading a lot about it, and I wanted to give some clarity on what exactly is the flight or fight response. So it's known as an acute stress response, refers to a physiological reaction that occurs in the presence of something that is terrifying, either mentally or physically. So the physiological and psychological response to stress prepares the body to react to danger, and the body remembers trauma. So for example, if I have a history of abuse and it all begun by, someone touching my shoulder and, let's say, for example, I'm at work one day and a colleague touches my shoulder in the same particular way, I might go directly into a flashback and my body is going right into that flight or fight response. And I may, scream. I might throw her hand off of me. I might start crying. I might have a reaction that to other people would be like a bit dramatic. But for me, I'm in my own head. I'm thinking about the flashback. I'm thinking, great, my shoulder's getting touched. Here, I'm about to endure some abuse. So right there, my heart starts to race. I start to get extremely anxious. Like I said, I may start screaming, help, help. She's hurting me, when in reality, she's not hurting me or he's not hurting me. They're just touching my shoulder, and I reacted because that's all I know. And that's really the flight or fight response, because right there my body was going into survival mode, in order to not endure that trauma that I had only ever known. So this brings me to my next point of, treating trauma and how to treat trauma. There are a lot of interventions out there, and a lot of research and a lot of books and articles about the exact correct way to treat trauma. And to be honest, the answer is that there's many techniques out there to treat trauma. You really have to figure out what will work best for your client in that moment. And sometimes, us as clinicians have to sit back and learn that we may not be the best clinician in order to give them their treatment, because maybe we're not formally trained in that form of therapy, or maybe we don't feel comfortable to really talk about their trauma, because we all have our own trauma as well. So therapeutically, CBT, EMDR, and biofeedback have been known to have the most effective results with treating trauma. Psychodynamic therapy is also known to treat trauma. However, that's more if there's more family issues related to trauma. Sometimes, if someone is in the war, necessarily that psychodynamic therapy isn't going to help their trauma, because psychodynamic will really focus on the family aspect. So there are other things that can help each client, such as exercise. Kickboxing is a big one. A lot of people think that therapy is the only way to treat trauma, but there are many other ways that people can get out their stress and their feelings, and that can be through exercise. Also yoga, meditation. Some people really like massages, because they hold a lot of stress, up here in their shoulders or, in their back. So a lot of those things can really help with stress management, which can help decrease the level that you feel that your body is holding in. The right intervention is key, as the client will be able to communicate their progress through the talk and through body language. If you're doing a few sessions and you notice by session 3 or 4 that, you're really getting nowhere with the client, then you really need to reevaluate how you are intervening with their trauma, whether it's really affecting them. Also, the best thing that sometimes we can do for clients is actually refer them out to big support groups, because through our case management skills and through referring, we can actually really empower our clients. Sometimes the best and strongest relationships that clients will encounter are through support groups and peers that they found. Some big ones are Women Against Rape and, Mothers Against Drunk Driving. Those big support groups, like such to that magnitude, can really be empowering to a client and helps them feel like they're not the only one in the world who's experienced what they've experienced, and other women or other, men have gotten through the trauma and they can too. And that's a really empowering experience for someone who's endured trauma. So the last thing I want to discuss is how, your own trauma and our own trauma can come out when working with a client who has endured similar trauma that we have. It's really important to understand how your own trauma affects you and how it could affect your therapeutic interventions with your clients that you see. Always being mindful of how you feel is key so that you can make a clinical impact on your client and not just push your feelings of your own trauma onto your client. And that's very, very important. It's also very important to really have an understanding of what's going on in the community that you serve when you're a therapist in the community. For example, if there was, unfortunately a suicide in your community, your clients may feel that, and it's very important for you to be knowledgeable about what's going on in the community around you. Your client may have related to them in a sense of they're dealing with their own depression. So for them, it's more real as to, I've had similar thoughts that person did. It could have been me. I could have made that choice, or unfortunately, if it's someone they know from work, or if, it's a child that goes to the same school as, their child, it can really affect them in many ways. So it's really important that you always know what's going on in the community. So what I really want you to do this week is really to be able to identify with yourself, your own trauma and your own feelings. And I want you to really think about what client that you would work with that has that similar trauma would be difficult for you. So I really want you to think about, and so what I'm looking for in the post is what population and trauma would be hard for you to work with and why. So, for example, if it, is a suicide, is a rape, it's a sex offender, it's a loss of a home, it's a divorce, just to name a few, there's 1,000 different traumas out there. So I want you just to really think within yourself, what trauma would be hard for me to work with a client on and why. It doesn't have to be very long, but I want you guys to be able to recognize that so that you can start to work on that now. So when you do have a client that comes in with that particular trauma, you're able to really work with them on their trauma and not be experiencing your own. All right. I hope this was helpful, everyone. Have a great week. And if you have any questions about your paper, please feel free to let me know. Thank you.